So my job title is Medical Director of Moorfields Eye Hospital, NHS Foundation Trust, and essentially that means I am the sort of lead doctor for the organisation. I represent the medical side of things on the board of the hospital, and I am responsible for the quality and standards of clinical care that's delivered by the doctors in this hospital. So I am essentially the medical conscience of the Trust's board. I think it's important for us to recognise that ophthalmology in the hospital setting has got a lot of challenges. As the ageing population increases, the number of patients requiring treatment in those conditions goes up. And what needs to happen is that we need to think more, be more agile in how we deal with this capacity issue. And that means coming up with new ways of seeing patients. Some patients, particularly in things like glaucoma or medical retina, can be managed once they've been diagnosed and treatment initiated in the community setting. And I think one of the things that we're looking to exploit is teleophthalmology to help facilitate this. So in other words, where you in practice can do the OCT test for someone who you think may have wet AMD, those images automatically come up to the hospital. You'll get advice from a medical retina specialist, and that will get fed back to you in practice, whether or not you need to send the patient up or whether you can manage and monitor them there in practice. I think for the coming years, there's going to be a lot of emphasis from me in terms of the clinical side of things to make sure that we can introduce these new pathways, introduce this new technology, but always with a view to making sure that we provide the highest possible level of care for our patients. We're in a financial situation where there isn't enough money to go around, and how much we get paid for doing an increasing amount of work will go down. So it then puts back the challenge: how do you respond to that challenge in terms of, can we do what we do more efficiently, using technology in different staff groups, and perhaps at a different location rather than being in an all singing, all dancing hospital setting. I think a lot of the opportunity rests in what I've already described in terms of how much more closely we can work together to make things easier for our patients in terms of accessing eye care, getting the right tests in a timely fashion, getting the right diagnosis in a timely fashion, but also not inconveniencing patients by unnecessary referrals to the hospital, long waits in hospital. All of those things will make eye care in this country much better if we work much more closely in the future.